So in this video I'm going to be talking about the common question of if you only had one organ and you had multiple people who needed it, then who would you give it to? So we'll just talk through some examples of the kind of people that can crop up who would potentially need this organ. So we've got, in this situation, we've got 4 people. So usually in the interview they'll give you about 3 to 4 people. So we've got the mother of the 2 children, an ex-alcoholic, 14-year-old boy and an 80-year-old man. So the first thing is with the mother of the 2 children. The question is, why does she need it? So there's many different types of diseases that can affect the liver. There's autoimmune conditions, could be a genetic problem. Sometimes women during pregnancy, there's a very rare complication where they can get damage to the liver because of an autoimmune reaction secondary to the pregnancy. It could be hepatitis secondary to an infection, it could be due to alcohol, it could just be due to fatty liver disease. Might be intoxicants, so she might be an alcoholic, might have taken, recreational drugs. It might be something like cancer. Now, if someone has liver cancer, we usually put them on palliative care, so it's not really something that you can perform surgery on, it's not really curable. So the question is, if we give her the liver, so first of all, is she compatible with the liver? So the body needs to be able to obviously accept the liver. The question is, will her body accept it? So will her body accept it or will it reject it? Because if it's, say, an autoimmune condition and this is why her liver's failing because her body's destroying it, chances are it's probably going to destroy the other liver that she gets. So in that case, is there really any point in giving the liver? If it's, say, due to an infection, it could be that, once you replace it, the new liver, hopefully doesn't get infected. So ultimately it depends on, can she even have the liver, and if she can have the liver, what's the likelihood that that liver is going to survive, and for how long is it going to survive? Because some organs, they can last 15-20 years, like some kidney transplants, but then other kidneys, they can be rejected within 24-48 hours, even within a couple of hours. And then there's the circumstances of her children. They've intentionally mentioned 2 children or just children to basically get more empathy for the mother. Oh, she's got 2 children, someone who's going to take care of them. Well, we need to ask, does she even look after the children? Are they under her custody? Could be, they're just biologically her children, but she's not actually looking after them. Especially if she is, say, an alcoholic or drug addict, it may be the kids are taken away from her and they live in foster care. And does she plan on looking after these children long term? So these are obviously important things to consider. It might not seem that important, but as you can see, there's so many things to consider. And it might be that the other people in this scenario, they might also have children. So then it becomes a case of, well, we need to think about the nuances to be able to make a fair comparison. So now we move on to the ex-alcoholic. So firstly, ascertain, the drinking history. It could be that, the alcoholic, maybe he stopped drinking only a week ago, and now he's saying, I'm an ex-alcoholic. Technically he is, if he's given up a week ago and he stopped drinking, but there's a big difference between, someone who's given up a week ago versus someone who's given up, say, 2 years ago. The person who's given up 2 years ago and they've stayed like that, chances are they're going to stay like that, and they've obviously shown that, they're willing to put the effort in, whereas someone who's only been off alcohol for a week, it's very unpredictable. Then you've got the fact that alcohol might not even be the reason why he needs a liver or she needs a liver. So they've thrown in this ex-alcoholic to make you think that it's probably because of the alcohol, but it might not be that. It might be for the aforementioned reasons. like cancer, hepatitis, secondary to maybe even drug use, so other intoxicants. It might be they're a healthcare worker and they've sustained a needle stick injury and they contracted hepatitis B or hepatitis C, and this is why they now have a liver problem. Could be they've got liver cancer. These are obviously things that we need to know before we make this decision. And then if it is due to the alcohol, ask, is this patient planning on drinking alcohol in the future? So some people, they might give up their addiction just so that they can get onto the, organ register, they can get the organ, but they plan on going back to the old ways once they receive the organ. Okay. And again, is the patient even compatible with the liver? And do they have any other diseases? So it might be that you give the liver and you solve the liver problem, but they might have other diseases. So if it's, an ex-alcoholic, it might be a drug addict as well, so might have contracted HIV or something, or, some other disease from sharing needles. And so it might be that while we can get rid of the liver problem, we can't get rid of these other diseases that they've contracted, and those diseases may kill them. So in that case, is there any value in giving them that liver? Then we've got the 14-year-old boy and the 80-year-old man. So again, with the 14-year-old boy and the 80-year-old man, ask, why do they need it? Is it an autoimmune condition? Is it a curable illness? Do they have any other diseases that we need to factor in, that might, affect the success of a liver transplant? And there's other things as well that, in the other situation with the mother with the 2 children, they've explicitly made it clear that the mother has 2 children. Now the 14-year-old boy, it's unlikely, but he might have children, or he might have, adults like his parents that are dependent on him, because we do have young people who are working outside of their school hours to help with the family because there's an income problem, or maybe the parents are disabled, they can't work, and so the 14-year-old is having to support their family. So they may have dependents on them. They may be in foster care and have siblings with them. And then the tendency is to think that the 14-year-old boy has a longer lifespan than the 80-year-old man. Now that may not be true. The 14-year-old boy might have cancer that's spread to the liver. So in that case, if the patient's got widespread cancer, and let's say the 80-year-old man, he's just got some disease of the liver because of infection that can be cured. And if you give him a liver transplant, we can remove that infection, then, who's more likely to live longer? It might be the 14-year-old boy dies tomorrow. It might be the 80-year-old man has another 20, 30 years of life left. And again, the 80-year-old man himself might have dependence on him. He's far more likely to have had children, probably even grandchildren. So it's important to think about all these things. The reason why is because healthcare emphasizes quality over quantity a lot. So it thinks about, what's the impact of quality of life of a patient. Because if it extends the quantity of life, but not the quality of life, then we don't see it as valuable as if we extended the quality of life far more than, say, the quantity of life. So just to conclude, don't fall into the traps like the mother with the 2 children. It might be the rest of them all have children as well. And be open-minded. So these are not, these are very, very complicated decisions. And as you see in the rows below, you can't make the decision without all the information. You feel free to ask for information in the station. They probably won't have the information because really they're just testing your ability to analyze things holistically, and they're looking to see are you open-minded, because when you come to make these decisions in real life, you will have to factor all these in, because at the end of the day, 4 people need a liver. It basically means one person's going to live and the other 3 are going to die, assuming that that liver transplant is successful. So you're sacrificing 3 people at the cost of that one person. And again, assuming that these other 3 people don't end up having organ transplant later on, because maybe there's another liver available. But ultimately, that is a decision you're making. One person lives, the other 3 dies. The other 3 die. And so this is why you usually have an MDT discussion. So MDT again means multidisciplinary team, which I've discussed in a previous video. And if you're going to make the decision, likely you'll discuss it with your other doctor colleagues, maybe nurses who specialize in whichever field. If it's, if it's a lung transplant, it's a respiratory nurses. You might discuss it with the family of the patient alongside the patient. So what's called a best interests meeting. We get all the colleagues who are involved in the care with the patient and the family to discuss what's in the best interests of the patient. Because it might be the patient wants or needs the organ, but they don't want it because they don't want to carry on living. So it's a lot to consider, but there's no right or wrong answer in this scenario. It's literally just, are you capable of knowing what factors to consider, and can you be open-minded? And if they press you for an answer, initially say, I need more information. And if they keep saying, okay, but with the information that you have, what decision would you make? Then you can say, I choose this person, but make sure you say, but I'm making this decision based on the limited information. But in the ideal scenario and in real life, I'll try my best to gather as much information as I can before I make the decision and discuss it with my colleagues. So that's all. That's how you answer this question. If you have any questions, please leave any comments and like and subscribe. And one last thing I forgot to mention, which is check if the patient can even survive the surgery. So many people, they have other health conditions, typically, especially in far more elderly patients like 80-year-olds, 90-year-olds. They have other health problems that will stop them from being able to make it through the actual surgery. So for example, people with severe heart failure, or maybe the patient's on treatment for cancer, things like this, it can far increase your risk of dying at the table. So even if they are a recipient and they are a match for the donor organ, it might be that they can't even survive the procedure itself.